Welcome to the bathroom. My son Benjamin has Hirschsprung's disease. Hirschsprung's disease means that when his colon started forming, his gastrointestinal tract, toward the end of his colon, it did not form the nerve cells properly, and so it doesn't function properly. A colon is supposed to go like this, and his was just shut. It didn't have the movement it's supposed to. So he had to have a portion of his intestine removed when he was a child. After the surgery, we had a lot of trouble with incontinence of his bowel movements, up to 8 to 10 times a day. So we looked into options for managing that, and what we came up with was going to the bowel management program at Cincinnati Children's Hospital, and they recommended Malone antegrade colonic enema. What that means is that in Ben's little body, if this was Ben, this is his little shadow buddy, but if in Ben's little body, his appendix was pulled up to his belly button. So his appendix meets his belly button right here, and we actually insert a catheter into his belly button and flush fluid into his belly button every day to keep him from having bowel movement accidents. We use this bag to flush the fluid, and we hang it up in the bathroom, and that's how we keep Ben from having bowel movement accidents all the time, and it actually has worked wonders for us. The other thing that Ben has is he is a leukemia survivor, and during the early stages of his leukemia treatment, we were actually potty training him for urine, but somehow during the treatment, his bladder had nerve damage. So now he's not able to relieve himself of urine. We were looking into options for best management for that. And a big deal for us, Ben has Down syndrome as well, and he doesn't understand, who can touch where. It's really hard to teach him about good touch, bad touch, and all of those safety issues. So one of the things that we were really concerned about is catheterizing him through his penis and touching his penis every day, and having teachers or whoever else might have to care for him, grandparents, touching his penis. So that was a big deal for us. Same with enemas. A lot of kids with Hirschsprung's disease get enemas, but we didn't want people touching his bottom every day in that way. So when Ben had his Malone antegrade colonic enema surgery, MACE surgery, we also worked with a urologist who did Mitrofanoff. Mitrofanoff surgery is, they actually used his appendix for that too. So they have half of his appendix hooked up to one side of his belly button, and then on the left side of his belly button, his appendix is hooked up to his bladder. So it's a direct portal from his belly button to his bladder, and we catheterize him and drain his urine from the left side of his belly button. And that's called a Mitrofanoff, which means that they just used his appendix. That's the name of the person who did that. So that is something that we do every day for Ben, several times a day, to make sure that he does not have major urinary incontinence accidents. Ben is still in pull-ups, but this keeps him much cleaner and keeps him from having large volume accidents. We decided to have the surgery because his accidents were such that he was making puddles on the floor, and in school that's obviously a problem. So in the morning we mix up a glycerin and water solution, put it in Ben's bag, and then we insert a catheter into his belly button and flush the fluid into his belly button, which goes into his large intestine. That's enough fluid. It was tailored to Ben by the people at Cincinnati Children's Hospital Bowel Management Program, and it is enough fluid to flush all the way through his large intestine and get all of the bowel movement out of that. So he will stay clean for quite a long time after his flushes, usually 24 hours. He'll stay clean, give or take a little bit. We use lubricating jelly to do that, and we have all the supplies right here by the potty. And then once we are done with that and his bowel is empty, while he's still on the potty. It takes about an hour, all told, to flush the fluid in and to get him to have clean out his bowels. So he sits there, we let him play with his iPad, because what else are you going to do on the potty for an hour? Then we take the urine catheter and we drain his bladder through his belly button, and that keeps Ben clean and dry. And it's one of those really wonderful things. We had a lot of doubts about having the surgery. It was a major surgery, and you know, when your child's been through a lot, he'd already had Hirschsprung surgery. Like I said, he's a cancer survivor. We really agonized over whether or not to have the surgery. But at the end of the day, we decided that it's really important for Ben to have the dignity and the quality of life that not soiling his pants or having major urine accidents would give him. So for us, that has been an excellent thing. It's been extremely helpful, and Ben has gotten to the point where he's used to it and he knows that's part of his life. It is still a struggle every day. Nobody wants to sit on the potty for an hour, and but he does pretty well with it, and we're very thankful. So, and Ben does like to play with his little shadow buddy toy that helps him, you know, kind of cope, to know that he gets to do the same thing to his doll that is done to him. So if you have any questions, I'm sure I can answer them if you put them in the comments. I will be watching for any questions you have. Thanks.